Hi, everybody. I'm here with Martine Pierre Louis. She was, believe it or not, my boss in a past life, but she was also one of the founders. And we have her message today about 3 items that sent her down the path to fight towards social justice and linguistic equities. Martine, welcome and tell us more about that journey.
Yes. Hello, everyone. My name is Martine Pierre Louis, and um, in my current position, I am Director of Equity, Diversity, and Inclusion at Harborview Medical Center in Seattle, Washington. And I really do feel that I got my start in equity through language access. And my God, I go back a long ways. I remember 30 or plus years ago, organizing with everyone and listening to stories. I love listening to stories and using those stories as the focal point for organizing. But also, I love um, galvanizing those stories and pulling them together to find that thread that carries for entire communities. What was what I learned specifically was that when I was director of interpreting services, probably about maybe 15, maybe more years ago, I had the opportunity to participate in the Language Quality Improvement Initiative through the Robert Wood Johnson Foundation with a few different programs around the country. And we were to do something that was really unusual. And our medical centers that we worked at were to change the way in which we collected language information from all patients. So many hospitals collected language information from patients by by asking patients like me that have non-Anglo names, do you need an interpreter to communicate about your health? And just putting that down in their registration. But who are to change our registration processes and actually ask every single patient who registered for care in our system, in what language do you want to communicate with your healthcare team? And so I think it was about 15 or 17 years ago that we were to change our registration processes. And I remember asking the team that was putting together that system, so even if someone is called John Smith, we're actually going to ask them, in what language do you want to communicate with your healthcare team? And they said, yes, we're going to ask everybody. And I took a deep breath and I said, okay. Um, and so what that did was that we went from having about, 50% of our patients with a particular language identified to over 99% of our patients with a language identified. And if it was English, it said English. If it was American Sign Language, it said American Sign Language. If it was Spanish, it said Spanish. If it was charm, it said charm. But then what we learned was that we could use that information to learn something about how we were performing as a medical center, as a medical system. So we could see, so how are patients with diabetes, as an example, faring in our system? How are patients with high blood pressure doing in our system? So we learn that simply by using language, we could really see how Spanish-speaking patients with diabetes were doing within our system. So this is how I learned that we could actually use some information to get to equity information. So, this is part of what launched me into looking how our systems were performing for patients that do not speak English, and learning that, there are inequities. And we need to learn not just how our systems are performing, but we can design some interventions for patients that don't speak English. So, yeah, this is what got me started.
And finally,
On this
having
path.
metrics rather than anecdotal stories
Exactly.
to support the conclusions, because we
Exactly.
all know the people at the top don't enjoy those anecdotal stories nearly as much
Exactly.
as the hard numbers.
Exactly. So that now, that language quality improvement effort really launched us on a path to have hard data so that we could use those stories to illustrate the hard data. It was, I can say it was really, for me, I've never turned back. But it's been an amazing path for me. But I've learned so much. And hopefully, with this path, I've also been able to add some really important information and some hard data to the stories that all of us have been contributing.
And I thank you, Martine, because as we all know, that rising tide lifts all boats. And if the boat wasn't in the marina to begin with, we could not measure the effect of the tide. So
That's correct.
being able to collect that language information, I remember, has really made all the difference, made everything that has come since able to happen. So
absolutely. Thank you so much.
So much. Thank you, everyone.